As Tony Blair reflects on his decision to bring in FOI, the Act may have increased accountability, but at what cost? Tony Blair remarks that FOI is not a tool for the people, but a weapon for journalists. In a healthcare context, it has certainly contributed to the wider media phenomenon of doctor bashing. A 2001 BMJ paper that looked at 21 newspaper articles found that there were twice as many negative stories about doctors as positive ones. Now, whilst it is perhaps a truism that negative stories abound in the media, their potential manifestations in healthcare delivery are more insidious. A 2003 BMJ paper found that media attitudes had lowered morale amongst some junior doctors, leading some to consider leaving the profession altogether. With the increase in negative press surrounding healthcare, the NHS has been accused of spending huge sums on compensatory marketing. A reported £274 million was spent on PR and spin doctors in just 3 years. Meanwhile, negative press may lower people's perceptions of the healthcare they receive, whilst media hyping may raise their expectations. Taking satisfaction as a proxy for quality, to what extent do the media undermine efforts to improve it? Now let's cross over to our correspondent Marie-Claire Rooney, who has more on the phenomenon of media hyping.
Reports by the media often overestimate the benefits and minimise the risks associated with new therapies. Why? To sensationalise a story and ultimately to make more money. However, biased reporting also stems from drug companies' commercial lobbies in an attempt to pressurise both the public and the government to invest. Such media hyping can have damaging repercussions. Let's take the 2006 coverage of cancer drug Herceptin. The Lancet said at the time that evidence surrounding Herceptin was insufficient to make clinical judgments. News reports, however, claimed that it was a significant medical breakthrough. The Daily Mail even ran with the headline, "Wonder Drug Could Cure Cancer." Reacting to the media campaign, the British Secretary of State for Health put pressure on primary care trusts, saying that cost alone should not be a reason for refusal. This is just one example of how the media can influence the way we deliver modern healthcare.